welcome to the Deep Dive. Today we're going to get into something really important, especially if you're a fan of those wonderful boxer dogs.
That's right.
We've got some medical information here, and we want to break down boxer cardiomyopathy. You might also hear it called arrhythmogenic, right? Ventricular cardiomyopathy. Quite a mouthful.
Yep, ARVC for short, sometimes.
Our mission today is basically to pull out the need-to-know stuff so you understand the condition, the risks for boxers, and really importantly, what signs you might see.
Exactly. We're diving into the details, but making it accessible.
Okay, so let's start right at the beginning. What is actually happening in the heart with this condition? What's the core problem?
Well, the absolute core characteristic is something called ventricular tachyarrhythmias.
Okay.
These are basically abnormal fast heart rhythms that start in the ventricles, the heart's lower chambers.
And what can those lead to? The information sounds pretty serious.
Yeah, it can be. These rhythm problems can cause syncope that's fainting spells or tragically even sudden death in some cases.
Wow, okay. That's definitely concerning. Now, I saw something mentioned about heart failure being less common.
That's correct. While the main worry is often that electrical problem, the arrhythmias, a smaller group of boxers, the source says less than 5%, might actually develop congestive heart failure.
Okay.
And specifically with systolic dysfunction. So that means the heart muscle itself gets weaker and doesn't pump blood as effectively. It looks a bit like dilated cardiomyopathy you see in other dog breeds.
Got it. So is this strictly a boxer issue, or do other breeds get it?
It's overwhelmingly a boxer disease. They are definitely the main breed affected.
Hmm.
Interestingly, though, the text does mention a similar condition, but it's pretty infrequent, can pop up in English bulldogs too.
Okay, English bulldogs too sometimes. And what about age? When does it usually appear?
Typically, it's a disease of mature dogs. Think sort of the middle-aged range, usually between 5 and 8 years old. That's the most common window.
But I guess it's not always that straightforward.
No, not always. Those are typical ages, but there are definitely exceptions. Cases have been reported in puppies as young as 6 months.
6 months. Wow.
Yeah. And then on the other end, some dogs might seem perfectly fine until they're well over 10 years old before showing any signs.
So that range really means you need to be aware throughout their life, doesn't it?
Absolutely. It's not just an old dog problem or a middle-aged dog problem. It can really vary.
All right, so let's talk signs.
Yeah.
If you have a boxer, what are you actually looking for? How does it present?
Okay, so the information kind of breaks it down into 3 main scenarios or presentations.
Right.
First, you've got the asymptomatic dogs. These are dogs that show absolutely no outward signs of being sick. Nothing.
Nothing at all.
Nope. But then maybe during a routine vet check, the vet listens to the heart or does a quick ECG, and they find these things called ventricular premature complexes or VPCs.
VPCs, those are the extra heartbeats, or?
Exactly. Those little irregular beats. Finding those on a checkup is often a really key early clue, even if the dog seems fine.
Okay, so that's one way. What are the others?
The second way is syncope, the fainting spells we mentioned earlier. So a dog might collapse or faint, and then when they get checked out with an ECG or maybe wear a Holter monitor for a day.
That's the wearable ECG.
Yeah, the 24-hour one, that will usually show those VPCs are happening.
Okay, and the third way? You said it was less common.
Yes. The third and least common presentation is actual heart failure. This could be signs of left-sided heart failure. Things like coughing, breathing fast, difficulty breathing because fluid might be backing up in the lungs. Or it could be biventricular failure, affecting both sides. Then you might see fluid building up in the abdomen, what's called ascites, plus the rapid breathing and coughing. And of course, these dogs will also have those VPCs.
That all sounds quite serious, but there was something else on the notes that was even more, well, chilling.
Yes. And it's tough, but crucial for owners to know. Unfortunately, sudden death can happen before any of these other clinical signs become obvious. A dog could seem perfectly healthy one moment and then, well, it underscores why understanding the risk and potential early signs is just so important for this breed.
Definitely. Okay, let's shift to causes. What's actually behind this? We know it's often adult onset, but what makes a dog susceptible?
Right. So the big thing is that it's inherited. The source material is clear. It's passed down genetically.
Inherited, okay.
And specifically, it follows what's called an autosomal dominant pattern.
What does that mean, practically?
It means a dog only needs to inherit one copy of the mutated gene from either their mother or their father to be at risk of developing the condition.
Just one copy is enough?
Yes. Unlike some genetic conditions where you need 2 copies, for this one is sufficient to confer risk.
And have they pinpointed the actual gene involved?
They have identified a major one, yes. There's a specific mutation. It's actually a deletion, like a piece of the genetic code is missing in a gene called striatin.
Right.
Yeah. Striatin is involved in making structural proteins in the heart muscle. So a fault there seems to be a key factor.
So if a dog tests positive for this striatin gene deletion, does that guarantee they'll get sick?
Not absolutely guarantee they'll show signs, but it significantly increases their risk. And the information points out something else interesting. Dogs that inherit 2 copies of this mutated gene.
One from each parent.
Exactly. They're called homozygous. These dogs tend to have a more severe version of the disease.
More severe how?
They often have many more of those VPCs, those extra beats, and they seem to have a higher likelihood of their heart muscle actually weakening and the heart chambers enlarging.
That makes sense. Is that the whole story genetically, though? Just the striatin gene?
Well, the source is careful to say it's not clear yet if this striatin mutation is the only genetic cause. It suggests there might be other genes or maybe other mutations playing a role that we just haven't identified yet. So definitely an area where more research is needed.
Right. Always more to learn. Now, what about this L-carnitine connection mentioned in the notes? How does that fit in?
Yeah, the L-carnitine part is, well, it's intriguing, but still a bit fuzzy.
Okay.
The information describes one specific family of boxers. These dogs had the VPCs, their hearts were enlarged, and the muscle wasn't pumping well, systolic dysfunction, and tests showed they had low levels of L-carnitine in their heart muscle. L-carnitine is important for energy metabolism in the heart. When these specific dogs were given L-carnitine supplements, they actually showed improvement.
That sounds promising.
It does, but the text stresses that the relationship isn't fully understood. It was one family, and not all dogs with similar heart muscle problems respond to L-carnitine.
So it's not like a standard treatment for all cases?
No, not at all. It seems like it might be a potential factor or a helpful therapy in a subset of cases, perhaps those with that specific metabolic issue, but it's definitely not a guaranteed fix across the board for boxer cardiomyopathy. It highlights a potential pathway, but one that needs more investigation.
Okay, that clarifies it. So if a vet suspects boxer cardiomyopathy, what else do they need to consider? What could mimic these signs?
Good question. The source lists several differential diagnoses, other conditions to rule out.
Right.
One big one is aortic stenosis, especially moderate to severe forms. That's a narrowing near the aortic valve, and it can also cause VPCs.
Okay, so heart structure issues.
Exactly. Then there are rarer things like acquired heart diseases, neoplasia heart tumors, or endocarditis, which is an infection of the heart valves. And interestingly, sometimes problems completely outside the heart, like issues in the abdomen, particularly involving the spleen, can somehow be associated with VPCs too.
Really? Abdominal issues causing heart rhythm problems.
Yeah, the connection isn't always direct, but it's something vets need to keep in mind. Splenic masses, for example, are sometimes linked.
So how do they sort all this out?
Yeah.
Differentiate between them?
Imaging is really key here. An echocardiogram, that's the heart ultrasound, lets them see the heart structure, measure the chambers, check valve function, and assess how well the muscle is pumping. And an abdominal ultrasound helps them look at the spleen and other organs to rule out those non-cardiac causes.
Makes sense. Okay, let's talk diagnostics specifically for boxer cardiomyopathy itself. Genetic testing came up earlier. How does that work?
Yeah, the genetic test for that striatin mutation is readily available. The notes even mention the website for NC State's lab.
Right.
Owners or vets can send in either a blood sample collected in a specific purple top EDTA tube or even just a cheek swab, a buccal swab.
Oh, a cheek swab is pretty easy.
It is. And that test directly tells you if the dog has 0, 1, or 2 copies of that specific dilution. It's a powerful tool for assessing genetic risk, especially, for breeding decisions.
Definitely. And what about measuring L-carnitine levels?
You can measure L-carnitine in the blood plasma. This is typically done for those boxers that already show signs of heart enlargement and weakened pumping function.
Okay.
But here's a critical point from the source. A normal L-carnitine level in the blood doesn't completely rule out the possibility that the level inside the heart muscle itself might be low.
Oh, interesting. So a normal blood test isn't the final word.
No. Because of that potential discrepancy, even with a normal plasma level, a vet might still consider a trial of L-carnitine supplementation in a boxer with that specific presentation, the enlarged heart and systolic dysfunction.
Got it. What about other imaging, like X-rays? What do they show?
Chest x-rays or thoracic radiographs are often surprisingly normal, especially in the early stages or in dogs that just have the arrhythmias without heart muscle changes.
Hmm.
However, if the disease has progressed, if the ventricles have dilated and there's heart failure, then the x-rays might show an enlarged heart silhouette and signs of fluid in the lungs, like pulmonary edema.
Okay. And the echocardiogram, the heart ultrasound, you said that's key.
It is key, but it can also be normal, particularly in dogs whose main issue is just the arrhythmia.
Right.
But in others, especially those homozygous dogs with 2 copies of the gene mutation, the echo can clearly show the dilation of the ventricles and the poor systolic function, the weak pumping.
But it sounds like tracking the actual electrical rhythm is maybe the most direct way to diagnose the ECGs and Holters.
Absolutely fundamental. A standard ECG, the quick one done in the clinic, is a starting point. It might pick up some VPCs. If it shows VPCs with a specific shape, an upright morphology in certain leads, that's quite suspicious for this condition. But the problem is, these VPCs can be intermittent. A dog might not have any during that brief ECG recording.
Right, you can miss them.
Exactly. That's why Holter monitoring the 24-hour ECG is so highly recommended.
Because it records for much longer.
Precisely. It gives a much better picture of how frequent the VPCs are if they're happening in bursts, like runs of ventricular tachycardia, or in patterns like couplets or bigeminy. It quantifies the problem.
It gives a baseline for treatment too, right?
Yeah. Yes, absolutely critical for monitoring response to therapy later. The source suggests Holter is really the way to go if you suspect ARVC, or if a screening ECG looks iffy. It even notes that if a Holter isn't feasible, starting therapy might be considered just based on symptomatic dogs having those suspicious upright VPCs on a regular ECG.
Okay, that makes a lot of sense. So digging even deeper, what's actually happening physically within the heart muscle tissue itself? What do they find if they examine the heart?
Well, looking at the heart grossly, just with the naked eye, sometimes it looks pretty normal, or there might be some mild to moderate enlargement of the ventricles. It's often not dramatically obvious.
So the real changes are microscopic.
Yes, the key is in the histopathology, looking at thin slices of the heart tissue under a microscope.
Now, what do they see there?
The hallmark finding, the defining feature, is fatty and fibrous tissue infiltrating the heart muscle wall. It typically starts in the right ventricle wall, but it can also affect the septum, the wall between the ventricles, and even the left ventricular wall.
So fat and scar tissue replacing normal muscle.
Essentially, yes. And you can imagine how that replacement disrupts the normal structure and, crucially, interferes with the electrical pathways that are supposed to make the heart beat regularly. That's what leads to the arrhythmias.
Wow, okay. That paints a clear picture. Let's talk treatment then. What are the goals when you start treating a dog with boxer cardiomyopathy?
The main aims are, well, threefold, really. 1, reduce the number of those abnormal beats, the VPCs. 2, alleviate any clinical signs the dog is having, like fainting or exercise intolerance. And 3, attempt to reduce the risk of sudden cardiac death.
Attempt to reduce.
Yes, and the source material is very careful to point this out. While that's a major goal, there isn't currently solid scientific evidence proving that the available antiarrhythmic therapies actually do prevent sudden death in these dogs.
That's a really sobering but important point for owners to grasp.
It is. We treat to manage the rhythm and symptoms, hoping it reduces the risk, but we can't guarantee it eliminates that sudden death possibility.
Okay. What about those dogs that are asymptomatic? They feel fine, but a Holter shows lots of DPCs. Do you treat them?
That is a really controversial area. It's debated among cardiologists.
Why the debate?
Because every antiarrhythmic drug carries a potential risk of actually worsening arrhythmias in some individuals. It's called a proarrhythmic effect.
Oh, right. The treatment could backfire?
Potentially, yes. So the decision to start medication in a dog that feels perfectly fine, just based on Holter numbers, needs very careful consideration of the potential risks versus the uncertain benefits in terms of preventing sudden death. It's a case-by-case discussion with the owner.
When does treatment become less controversial then? When is it generally started?
Therapy is more clearly indicated generally if certain thresholds are met on the Holter monitor. For example, having more than, say, 1,000 BPCs over a 24-hour period is often used as a guideline.
Okay, over 1,000.
Or if the Holter shows significant runs of ventricular tachycardia, those fast bursts of abnormal beats. Also, signs of arrhythmia complexity, like frequent pairs, couplets, or alternating normal and abnormal beats by
Right.
Gemini.
Hmm.
And definitely, if the dog is showing clinical signs that are clearly linked to the arrhythmia, like the fainting spells or struggling with exercise, then treatment is usually recommended.
Gotcha. The notes also mention stress and excitement as potential triggers.
Yes, that's observed clinically. Episodes of syncope and potentially even sudden death can sometimes occur during or shortly after periods of high stress or excitement.
So try to keep things calm.
As much as is reasonable for a boxer, yes. Avoiding known high-stress triggers might be helpful.
What about exercise restriction? Should these dogs be kept completely quiet?
Interestingly, the source says there's no definitive proof linking exercise restriction to improved survival. Yeah, and sadly, sudden death can occur even when a dog is completely at rest. So, while maybe avoiding really strenuous extreme exertion makes sense, the current thinking isn't generally to enforce strict cage rest or complete exercise elimination. Quality of life matters too.
Okay, good to know. Let's talk specific medications. What are the go-to drugs for the arrhythmias?
The primary choices, the first-line drugs mentioned, are sotalol and mexiletine.
Sotalol and mexiletine.
Yes. The text provides typical dosage ranges for vets. They are often the starting point for trying to control the ventricular arrhythmias.
Do they work differently?
They do. They belong to different classes of antiarrhythmics and have different mechanisms of action on the heart's electrical system.
So what if one drug isn't enough?
That's where combination therapy often comes in. If a dog still has significant arrhythmias on just sotalol or just mexiletine, adding the other drug can be quite effective. Using them together often works better because they tackle the arrhythmia from different angles, and they are generally considered safe to combine.
Okay. And for that small percentage of dogs that develop heart failure, what's the treatment approach there?
For those dogs, the treatment shifts to managing the congestive heart failure itself. This involves the standard heart failure medications.
Like diuretics?
Exactly. Things like furosemide to get rid of excess fluid, ACE inhibitors like enalapril to help blood vessels relax, pimobendan to help the heart muscle contract better, sometimes spironolactone, and potentially L-carnitine might be considered for these dogs too, given that possible link we talked about earlier.
Right. Are there any major watch-outs when using these antiarrhythmic drugs like sotalol or mexiletine?
The biggest one, as we touched on, is that proarrhythmic potential. Any antiarrhythmic can, paradoxically, make arrhythmias worse in some dogs.
So monitoring is key.
Absolutely crucial,
Mm.
especially when starting a new drug or changing a dose.
How is that monitoring typically done? How do you know if the treatment is working?
Ideally, you'd repeat the Holter monitor maybe about 2 weeks after starting the medication. That gives the drug time to reach steady levels.
Okay, repeat the 24-hour ECG.
Yes. But interpreting in the results needs care. The source points out that the number of VPCs a dog has can naturally vary quite a bit from day to day, maybe by as much as 85% even without treatment changes.
Wow, that's a huge natural variation.
It is. So you can't just look at a small drop in VPCs and assume the drug is working perfectly. Generally, cardiologists look for a really significant reduction, often aiming for at least an 85% decrease in the total VPC count compared to the baseline Holter.
85% reduction, that's the target.
That's often considered a good response numerically. But improvement in the complexity of the arrhythmia, fewer runs of VTach, fewer couplets, and improvement in the dog's clinical signs are also really important goals, even if the total VPC count doesn't drop by quite that much.
Makes sense.
Ah.
It's not just up the numbers. What about long-term? How often do they need checks?
Because the disease can progress over time, the arrhythmia might worsen, or heart muscle changes could develop later. Ongoing monitoring is recommended. The source suggests annual Holter monitoring and annual echocardiograms as a reasonable approach for long-term management.
Okay, annual checks. Finally, what's the overall prognosis? What should owners be prepared for?
Owners need to understand that, unfortunately, the risk of sudden death remains, even with treatment. That's the hard truth.
Right.
However, the information also provides some hope. Many affected dogs, particularly those without significant heart muscle dysfunction, can live for years with a good quality of life while taking their antiarrhythmic medications.
So management can often be successful for a long time.
Yes, for many dogs, absolutely. The prognosis tends to be more guarded, poorer for those dogs who do develop the systolic dysfunction and heart enlargement. Although, again, L-carnitine might offer some benefit in a subset of those specific cases.
This has been incredibly informative. Thank you. So just to quickly wrap up the key takeaways, boxer cardiomyopathy, it's primarily an inherited condition in boxers. The main feature is these abnormal heart rhythms, the VPCs.
That's the core.
Early detection through regular vet checks and especially Holter monitoring seems really crucial.
Vital, yes.
And while there's no magic bullet to guarantee prevention of sudden death, understanding the signs, knowing the treatment options like sotalol, mexiletine, maybe L-carnitine in some cases, can really help manage the condition and maintain a good quality of life for these dogs for, hopefully, years.
Well summarized.
Right.
And the genetic link and the ongoing questions around L-carnitine really show this is still an active area of research.
Absolutely. Which brings us to a final thought for you, our listeners, to ponder. Given that we know there's this strong genetic basis, particularly the Strytin gene mutation, what does that mean for the future? What are the possibilities and maybe even the ethical considerations around using genetic screening and shaping breeding practices to try and reduce this condition in the boxer breed?
That's a big question. And maybe another angle. Why do some dogs with heart muscle problems seem to respond to L-carnitine while many others don't? What could further research into those non-responders tell us about the deeper or maybe different mechanisms driving this disease in different individuals? Lots to think about.